Creme Wealth Management, we come with no pretense. Financial advising, making money make sense.
So, COVID, we thought it was gone, seems to be coming back a little bit. I've gotten some questions around, what should we be doing? Is there anything to do? And just wanted to share a conversation I had with my brother this past week, who is a local ER physician, just to give you some perspective from someone who's truly on the front lines and not just the news media articles. I'll leave the video for you to look at and just know, let's have a conversation if you're at all concerned about the potential of a resurgence happening, what that could mean on your portfolio, your financial plan. But we do want to try to get ahead of some of the potential hysteria that could come down the pike. So enjoy this conversation and let me know what questions you have. Thanks.
As way of background, I'm the Chief Medical Officer at Total Care, which is a series of freestanding emergency rooms and urgent cares in the DFW area. We currently have 5 freestanding ERs and 4 urgent cares that we operate in this area, and we are a COVID testing and treatment center. So we've been in the epicenter of the COVID stuff since it very first started. Of the first 5 cases of COVID in Tarrant County, 4 of them were at our place. So we've seen it right from the beginning all along, and we continue to try to stay right on the forefront of where things are at, and things to come as far as COVID goes. And we're definitely seeing an uptick right now in the number of folks coming in. In fact, in the past week, the number of COVID cases that we've had in our facilities has just about doubled. So it's definitely here right now. We don't have a way to type which variant it is, but you can basically assume it's the Delta variant. There is a Lambda variant that's been identified in Houston, so we may even move on to the next one to come shortly. But for right now, we're still just assuming it's all Delta. The trends that we've noticed is that the prior COVID variants that we had seem to target very heavily the elderly. And this particular one seems to, for whatever reason, be particularly good at getting younger men. So as we're talking here, I've got a 31-year-old with a COVID pneumonia that's in our facility. His friend was just hospitalized, another young man without prior health issues with a COVID pneumonia. So it seems to be predominantly the young men that are getting hit the hardest right now. As far as vaccine status goes, we've noticed that the Johnson & Johnson vaccine does not seem to be particularly effective at the Delta variant. The Pfizer one and the Moderna one seem to have a little more efficacy. However, their real benefit is preventing you from dying from the vaccine. They are probably about 40% effective at preventing you from catching it, which means that there's a good chance that even if you're vaccinated, you could still end up catching it, spreading it. And that's partly why you're seeing the press that's going on right now towards masking up anyway, even if you're vaccinated, to try and cut down the spread. I know that the statistics out of Massachusetts came out this morning that I noticed 75% of their COVID hospitalizations are folks that have been fully vaccinated. So it's definitely still able to get folks, although I don't know whether those folks were J&J vaccines. I don't know how long ago they were vaccinated. And another thing that we noticed is even the folks who've gotten the Pfizer vaccine, we measure antibody status, and they're starting to drop off, which means that if you were on the early end getting the Pfizer vaccine, back when it was first coming out, it may be that your antibodies are even waning. We were hopeful they would last longer, but it's not entirely clear that that's the case. So it's likely what we're seeing moving forward for the next 3 months, we're going to see more COVID being diagnosed. The hospitals in the DFW area are currently at capacity right now. and we're likely to see more shutdowns that are going to happen. Most of the time, the shutdowns I anticipate are going to be voluntarily from the employers rather than from a government mandated thing. But it doesn't take much of an impetus for an employer to have a family member or a friend that gets COVID, and it'll make them say, that's it, I want to just close for a while. This is very personally driven, very emotionally driven, more so than being mandated. We also know several big employers that are now requiring vaccine. Lockheed Martin has come out saying they want all their employees to get vaccinated, and there's a couple others. THR is asking all theirs to be vaccinated. As that moves on, that's going to shift the demographics a little bit, shift the trends a little bit. So we'll see what that does as far as the COVID outbreak as well. We're also seeing, go ahead.
What about the mortality piece? Some people have said, well, it's spreading, but people aren't dying, so that's not as big of a deal.
Well, this is true, but the mortality lags a little bit from the spread. So you'll end up seeing the mortality from today about 2 weeks from now. So those mortality numbers are going to creep up. They're definitely creeping up a little bit. I heard somebody who was talking about it yesterday during a virologist conference, and they mentioned that at its heyday in the US, we were having the equivalent of a cruise ship sink every day with everybody on board. It was that level of deaths per day. And currently it dropped down to where it's a Boeing 747 that's crashing every day with the amount of folks that are going and dying from COVID. So even though you might see the mortality is still, it's lower and it's better, it's not zero. It hasn't ever gone down to zero. And if you're one of the ones on that Boeing 747, it means everything. So I expect the mortality numbers are going to go up a little bit, but not as high as they were back in the original pandemic, because then everybody was unvaccinated, and it was taking out folks that were, compromised with other health issues. So it was, a lot of folks that were dying at that point in time with little that could be done. We're also pushing a lot more heavily for the monoclonal antibodies very early on. When those are used in folks that are antibody negative early on in the course of the disease, they seem to have a pretty decent effect in terms of decreasing mortality as well. So there's a push towards getting those monoclonals out there for treatment. But the availability of those is still limited. And unfortunately, most of the protocols for those monoclonals still include the fact that you have to be aged over 65. And those are not the folks that this is targeting as much as it is those younger men. So everybody's protocol is going to have to adjust a little bit. And it takes time for that to catch up, get through the administrative wheels.
So if this is growing at this, very fast pace, is there anything that you would counsel people to say, hey, just know this is what's going on, here's what you should consider doing or consider being aware of? Because for me, I'm concerned about what the markets are going to do once, a shutdown, if a shutdown comes and happens again. But also, what about schools? Is this going to be something that impacts kids in this variant where now we are back to everyone having to work from home just purely because of, childcare issues again?
Yeah, so they still feel like, as far as mortality in kids, it's not particularly bad. Even with the multi-system inflammatory complex that they saw happening in kids weeks after they got COVID, that even resolves over the course of a month. So the mortality in kids just isn't there. However, they are describing a long COVID syndrome, which can happen and can happen in kids as well. And what this is being attributed to is just like you get that loss of taste and smell, right? Which a decent number of people get. That appears to be from an immune complex. So it's almost an autoimmune generated thing where it attacks your nerve cell. And as your antibody level wanes to the COVID, that also recovers and improves, but that can take months before that happens. And that same attack on that taste and smell seems to also be attacking the general brain function. So they're describing a overall brain fatigue, if you will, in that long COVID, difficulty concentrating, just fatigue in general, um, inability to focus on things as much. And they're describing, for better or for worse, they're saying that that does affect the kids. And so you'll have kids that get COVID and they don't really seem that sick. They recover quickly, but their school performance for the next 2 to 3 months is just off. And that's making people say, well, maybe we should try to do more to prevent kids from getting that long COVID syndrome, where it does impact them. It's just not something that's as dire. And so that push is going to try to make us do more distance learning, more masking. I think the CDC has now said that they're recommending masks in any kids in the schools over the age of 2, unless they have some mental reason that prevents them from wearing a mask. So I mean, it's really being pushed. Will the schools shut down again? I don't know. That's a societal question right there, because it's a huge economic impact. Will the stores completely shut down again? I don't think the stores can handle it, economically, another shutdown. And if half of the population has been vaccinated and has enough immunity that when they get COVID a second time, that it's just a cold for them, it's not something that's going to put them in the hospital. I have a feeling that that kind of laissez-faire attitude is going to allow it to spread, and you'll end up with a surge. But I don't think people are going to take it as seriously as they did the first time, and I doubt there's going to be a big shutdown for it.
Okay. Well, thanks for some insight as to what's going on and kind of the update on the COVID saga.
Yeah, we're preparing here to be in a surge for the next 2 to 3 months. It's kind of what we're expecting. And our kind of internal forecasting is that things will surge up in August and September as the schools restart up. People will get into a rhythm, and in October it will peak and then come back down. But then starting in December, we'll have a second wave, kind of like we did last year, as everybody gathers for the holidays. They'll be together at Thanksgiving, they'll be together at Christmas. And those close gatherings where, nobody's masking, nobody's having any social distancing, and, somebody's got a little bit of a cold and they show up, and then, everybody gets it. Over there leads to the family surges that happen. So usually that'll peak back out again at the end of December, and into January before it'll trail back down in February. That's kind of what we're internally predicting and expecting. And it's very likely that this is going to be a cyclical thing, like flu, that's going to come every year. And we'll see it coming out in the fall, a double peak through the winter time, and then tailing back off into the spring and into the summer. So we may just need to be prepared for this in the future.